UK Prime Minister Boris Johnson is now out of the hospital just days after being released from intensive care. Johnson contracted the coronavirus and was later admitted to a hospital when his symptoms suddenly worsened. For the first time today, the world heard from Johnson in a video statement where he admitted it could have gone either way for him.
Good afternoon. I've today left hospital after a week in which the NHS has saved my life, no question. It's hard to find words to express my debt, but before I come to that, I want to thank everyone in the entire UK for the effort and the sacrifice you have made and are making. When the sun is out and the kids are at home, when the whole natural world seems at its loveliest and the outdoors is so inviting, I can only imagine how tough it has been to follow the rules on social distancing. I thank you because so many millions and millions of people across this country have been doing the right thing. Millions going through the hardship of self-isolation, faithfully, patiently, and with thought and care for others as well as for themselves. I want you to know that this Easter Sunday, I do believe that your efforts are worth it and are daily proving their worth. Because although we mourn every day those who are taken from us in such numbers, and though the struggle is by no means over, we are now making progress in this incredible national battle against coronavirus. A fight we never picked against an enemy we still don't entirely understand. We're making progress in this national battle because the British public formed a human shield around this country's greatest national asset, our National Health Service. We understood and we decided that if together we could keep our NHS safe, if we could stop our NHS from being overwhelmed, then we could not be beaten, and this country would rise together and overcome this challenge as we have overcome so many challenges in the past. In the last 7 days, I have, of course, seen the pressure that the NHS is under. I've seen the personal courage, not just of the doctors and nurses, but of everyone, the cleaners, the cooks, the healthcare workers of every description, physios, radiographers, pharmacists, who've kept coming to work, kept putting themselves in harm's way, kept risking this deadly virus. It is thanks to that courage, that devotion, that duty, and that love that our NHS has been unbeatable. I want to pay my own thanks to the utterly brilliant doctors, leaders in their fields, men and women, but several of them for some reason called Nick, who took some crucial decisions a few days ago, for which I will be grateful for the rest of my life. I want to thank the many nurses, men and women, whose care has been so astonishing. I'm going to forget some names, so please forgive me, but I want to thank Poling and Shannon and Emily and Angel and Connie and Becky and Rachel and Nikki and Anne. And I hope they won't mind if I mention in particular 2 nurses who stood by my bedside for 48 hours when things could have gone either way. They're Jenny from New Zealand, in Invercargill on the South Island to be exact, and Luis from Portugal near Porto. And the reason in the end my body did start to get enough oxygen was because for every second of the night, they were watching and they were thinking and they were caring and making the interventions I needed. So that is how I also know that across this country, 24 hours a day, for every second of every hour, there are hundreds of thousands of NHS staff who are acting with the same care and thought and precision as Jenny and Luis. That is why we will defeat this coronavirus and defeat it together. We will win because our NHS is the beating heart of this country. It is the best of this country. It is unconquerable. It is powered by love. So, thank you from me, from all of us, to the NHS. And let's remember to follow the rules on social distancing, stay at home, protect our NHS, and save lives. Thank you, and happy Easter.
All right, that message from the UK Prime Minister Boris Johnson, now out of the hospital. CNN's Bianca Nobilo is in London. So Bianca, you know, that seems a pretty stunning admission from the Prime Minister that it could have gone either way for him.
It's startling to hear that, Fred, that the Prime Minister, the leader of the United Kingdom, says it was touch and go for him last week. That's what we'd heard from those close to him as well. His fiancée, who's pregnant with their child, said on Twitter today that it had been very dark days, understandably for her, and that she felt she could never repay the debt to Britain's National Health Service. What we heard from the Prime Minister in that video, which he released this morning, recording after he got out of hospital, was moving. It's a powerful tribute to those who work in the healthcare service. He named them. It's unusually emotional to see that display, but appropriate in these circumstances. But Fred, what I really want to draw viewers' attention to is how important it is that actions follow up those words. That's something that I've been hearing from members of the health service and those on the front lines that I've been speaking to. Obviously, it's wonderful to hear the Prime Minister name those members of the health service who've come from all around the world that nursed him back to health. But there are still problems with PPE all over the country. There is an uneven distribution. There are certain aspects of the kit that people don't have enough of, and Britain is still well behind in testing. Also, this message comes on the day that Britain has hit the somber milestone, as the Health Secretary called it, of over 10,000 confirmed coronavirus-related deaths in the country, 737 recorded in the last 24 hours alone. And that's just hospital deaths, Fred. That's not those who've died in care homes, in prisons, or in their own homes. So it's so important that while we have this sensational and important story about the Prime Minister's health, never, ever to lose sight of what is happening in the country at large.
So with that said, are the expectations high that given his personal experience, that some of those things might be addressed?
That is the hope, and that was the pressure that was being put on the Health Secretary in the conference today. He was being asked questions about the personal protective equipment that still isn't coming into the hands of those who need it. The Prime Minister has clearly expressed his gratitude for the health service, and I'm sure will have an even more renewed dedication to providing it for them. But that is where the focus needs to be now, and I'm sure it will be in the coming weeks. But he is going to be recovering at Chequers, which is the Prime Minister's estate, tucked away in the country in Buckinghamshire, 16th century manor house. So he won't be leading in the same way as he was a couple of weeks ago. We don't know for yet how long he's going to be there. Dominic Raab is still technically leading the country and deputising for the Prime Minister. But Fred, all of the attention now is going to be making sure that those medics get what they need.
Looking for that follow-up. All right, Bianca Nobilo, thank you so much in London.